All right, in this morning's Digital Dive, many people who need critical home care aren't getting it right now because workers are actually making more money on unemployment and also by staying home. And we had a lot of comments from our Sunrisers this morning. We're going to get to those comments coming up, but first, let's dig into our KARE 11 investigation. The disabled and elderly already face a shortage of personal care assistants, or PCAs, before this pandemic even started. Lack of personal protection equipment and higher pay to stay home has made the problem now even worse. State unemployment data shows between March 16th and April 18th, 1,933 PCAs applied for unemployment. PCA agency owners say they're seeing PCAs purposefully go on unemployment because with new federal $600 a week unemployment added to their regular benefits, they're actually making more money by not working. And this is a big problem for people like Lauren Thompson, who's a quadriplegic with spastic cerebral palsy. She needs a PCA to help her with basic needs.
Honestly, we've been in crisis for a long time, and this is just the cherry. And so I need a PCA to get me up, get me dressed, get me showered.
Oh, it just breaks your heart. Agency owners tell us they'd like to pay their employees better, but in Minnesota, it's a rate-controlled system. The state reimbursement rate for PCA services is about $17.80 an hour. And after employer taxes and overhead, PCA agencies typically pay their employees just the union-contracted $13.25 an hour. Now, some state lawmakers are trying to get an emergency funding bill passed that would provide a 15% bonus to encourage PCAs to come to work during this emergency. And it's not just about the money either. A lack of protective equipment, as we mentioned, like masks and gloves, has both PCAs and their clients that they care for concerned about the risks of these workers coming and going. And like I said, many of our Sunrisers are PCAs, like Jacqueline here, who says that she's still going to work through this pandemic and she knows the pay is bad, but says, quote, "I'm sorry, I have too much of a heart to see these people go without help." And Heidi says, as an in-home caregiver, we definitely deserve more pay. And we definitely can't disagree with Heidi there, or Jacqueline, Chris. But again, this is definitely a bigger problem. I know the lawmakers want this emergency bill passed but for this bonus that they'd essentially get. But I think there's a bigger problem in the long haul. They need to be better paid.
Oh, they sure do. It's always surprising how little some people in the healthcare field are paid. Really doesn't seem like we have our priorities straight there. Thanks, Alicia.